Ladd's procedure. Introduction. Ladd's procedure is the standard surgical treatment for intestinal malrotation, particularly when it is associated with midgut volvulus, twisting of the bowel around its mesentery. The procedure was described by William Edward Ladd and remains the definitive operation for correcting the anatomical risks associated with malrotation. Embryological basis. During fetal development, the midgut normally herniates into the umbilical cord, rotates 270 degrees counterclockwise around the superior mesenteric artery, SMA, returns to the abdominal cavity and becomes fixed. In malrotation, rotation is incomplete or abnormal. The mesenteric base remains narrow. The bowel becomes prone to volvulus. Fibrous peritoneal bands, Ladd's bands, may compress the duodenum. Indications. Emergency. Midgut volvulus. Intestinal ischemia due to volvulus. Elective. Urgent. Symptomatic intestinal malrotation. Recurrent bilious vomiting. Chronic abdominal pain related to malrotation. Goals of Ladd's procedure. The operation does not restore normal embryologic rotation. Its objectives are to relieve duodenal obstruction, prevent future volvulus, broaden the mesenteric base, place the bowel in a safer position. Operative steps. 1. Exploratory laparotomy, laparoscopy. The abdomen is entered and the bowel is inspected. 2. Detorsion of volvulus. If volvulus is present, the bowel is untwisted, usually rotated counterclockwise, since volvulus is commonly clockwise. 3. Division of Ladd's bands. Fibrous peritoneal bands crossing the duodenum are divided. This relieves duodenal compression and obstruction. 4. Widening of the mesenteric base. Adhesions around the SMA are released. This broadens the mesenteric attachment and decreases the risk of recurrent volvulus. 5. Placement of bowel. The bowel is intentionally left in a non-rotated position. Small intestine right pointing arrow right side. Colon right pointing arrow left side. This configuration minimizes future twisting. 6. Appendectomy. The appendix is removed routinely because it lies in an abnormal location after the procedure. Future diagnosis of appendicitis could be difficult. Postoperative care. Nasogastric decompression, if needed, intravenous fluids. Gradual reintroduction of feeds. Monitoring for bowel function and complications. Complications. Early complications include wound infection, anastomotic leak, if bowel resection performed, sepsis, persistent ileus. Late complications include adhesive intestinal obstruction, recurrent volvulus, rare, short bowel syndrome, if extensive ischemic bowel required resection. Key examination points. Ladd's procedure is the treatment of choice for intestinal malrotation. The operation does not correct the abnormal rotation. Essential components: counterclockwise detorsion, division of Ladd's bands, broadening of mesentery, small bowel on right, colon on left. Appendectomy most commonly performed in infants presenting with bilious vomiting due to malrotation or volvulus. Mnemonic: DBPA. D. Detorsion of volvulus. B. Divide Ladd's bands. P. Place bowel, small bowel right, colon left, and broaden mesentery. A. Appendectomy. This sequence summarizes the core steps of the Ladd's procedure. Thank you.